Okay, we are live. This is Tali Berman, autism specialist, and I'm here today with Abigail Dar. So I'm going to take a minute who this person is, and just if you're wondering where we are, why it looks like a prison cell. We met for coffee, and Abigail Dar, the warrior that she is, and we're going to talk in a minute about how big of a warrior that she is, found a manicure salon, and we're using their waxing room upstairs. So we're in here with the beds and the wax, so we can have a little private time, a little quiet space to talk to you about her experience, Abigail's experience, both with her own son, using medical cannabis, and her fight. She's a complete warrior on helping to move this forward so that this can become an accessible treatment to as many families as possible. So welcome. We're excited to have you in this little salon with us. And we're going to spend about 20 minutes talking to Abigail about her experience. So Abigail first, I'm so glad that you're able to be here with us. I've had the honor of knowing Abigail for many years. I worked with her son Yuval.
He was 5 or 6.
When he was 5 or 6, and now he's 23 years old. So we've known each other for a long time. And let me tell you, there's no one I've met who has as much energy and persistence as Abigail. And she's putting it to incredible use right now. So what I want to first ask you about, Abigail, is in your experience with Yuval, how did you come across the use of medical cannabis? I'm just going to shift my chair. And what are the specific ways you've seen it help him?
Well, Yuval is, like you said, 23 years old. He received antipsychotic medication since he was 12 because it was impossible for us to deal with the restlessness and the steaming and everything. We waited till he was 12. Then by the age of 16, he started getting seizures, epilepsy.
I just want to say for women, because I know many parents have talked about their children developing seizures once they hit puberty, as they get older, so that is something that absolutely happens, and that's sort of what came up with Yuval.
Yeah, 30% of autistic people suffer from seizures. I must say that understanding today, the antipsychotic drugs also lower the age for seizures. So what happens, you give a population which already in risk to have seizures, medications that lower the age. I can't say it caused the seizures, the medication, but...
What do you mean lowered the age? Meaning they have it younger than they would otherwise?
No, it makes it more bound to happen.
More bound to happen. Okay.
Yeah.
So at the age of 16...
It's one of the side effects of antipsychotic medications is getting seizures.
Okay.
So I can't say they cause the seizures, but I know with the seizures comes also very aggressive, self-injurious behaviors, which I wouldn't believe my son will ever have. But
this happened at 16?
At 16.
Okay.
So what happened, we added the anti-seizure drugs, but we also had to go trial and error, changing the antipsychotics medication because it was impossible living. It went on for, I think, over 2 years like this. But by the age he was 18, it got worse and worse, the behavior issues. And I'm talking to autism parents, but the experience of living with your child, which you love him, and you're terrified from him because he's very smart. He wouldn't go on his big brother. He would look for me or the caregiver. And when he was 18, I just looked at my husband and I said, look, I don't know these medications, what they do. I just don't know what they do, and it seemed that it got make him more crazy than he did than without them. Let's give it a try. But it's a very very complicated process to take off these medications, and it took us, I think, 2.5 months, 24/7. Me, I'm Yuval's father, my husband, and our caregiver, to take him off all these antipsychotic medications. And what happened is that after his body cleaned from the medication, it seems that he's more calm than he was with them. So it was eventually, first of all, understanding that the assumption that you give medication and they help,
not necessarily the truth.
Not necessarily the truth. So for 2 years or more, we went on he got only anti-seizure medication, no antipsychotic. He was better, but he was better in the sense of behavior. He was still steaming and have more autistic voices, but he wouldn't be agitated and going crazy and outbursts. But still we had it from time to time. And I heard a lot. I read about cannabis. And Yuval neurologist, Professor Uri Kramer, is the one who does in Israel the study about CBD oil and seizure, untrackable epilepsy. And I called him and I said, I want cannabis for Yuval. And he said, you can't have it because under the qualifying condition for seizures in Israel, you have to be with untrackable epilepsy, 5 medication, and this is not the case with Yuval. But eventually I found a psychiatrist here in Israel. He's specializing in post-trauma and cannabis, and he said, I believe it can help your son. I will file a petition for it, but afterwards I don't know what to give him.
So just to clarify, so originally you were seeking it for his epilepsy?
No, I was looking for behavioral issues.
Because for epilepsy was your doorway in.
What?
Epilepsy was the doorway in, meaning that was the way that doctors would be willing to look at him as a case.
I think so, yeah.
Okay.
I think so because he wasn't complying to the epilepsy qualifying condition in Israel because he is balanced with anti-seizure medication, anti-epileptic drugs. But I think maybe it was, and I think also because he's old, so they're less worried about, with young kids, they're more worried about cannabis. And we had to appeal. They didn't approve it the first time, but we did eventually get access for it. And I was reading parents groups in the States because there's all kinds, and we started giving him. And it was literally like a magic from the first day. Wow. I mean, I could say until 2 weeks ago that for 18 months, Yuval didn't have violent outbursts. His wrist that he used to have this bite, he used to bite again and again, was totally clear. There was a scar I thought would never heal.
Wow. For 18 months, he didn't have a single outburst.
No.
And how often did he have outbursts before that?
Oh, it could be once a week or twice a week. But it's not only the outburst itself, it's living with someone you don't know when it's going to happen. You can drive with him. You can stay alone with him because it looks like something that comes out of some inner need. It doesn't, you can't expect it. Right. And a lot of parents describe these behaviors. So once I saw what it does to Yuval, I thought it couldn't be. It couldn't be they won't give access to kids like ours to medical cannabis.
Before we get into access piece, right? So for anyone who's listening who has a child who has self-injurious behaviors or aggressive behaviors or agitated behaviors and outbursts as you describe them, to listen very closely because it was just the first dose and then you saw that begin to go away. So 18 months where he stopped biting his wrist, he stopped having outbursts, where he was having them every week before that. And did you begin to already see a change in his epilepsy? Already his epilepsy was under control?
His epilepsy was under control. What's interesting, and we didn't take off the anti-epileptic drugs, but what's interesting is along the way in these 18 months, I was reading and trying all kinds of things, and at a certain point it looks like he's adjusting to the strain. And I said, okay, let's take a break. I'll give him, we'll do reset, what parents call. And 2 days after stopping, each time I did it twice, and 2 days after I stopped giving him, he got a major seizure. So I understood it does work on the neurological system there. And this makes sense because I know 30% of autistic kids have epilepsy. But the other 70%, it doesn't mean they don't have some kind of neurological disorders. And we do know that cannabis does heal or have a very big effect on neurological disorders. We know it from the ALS, we know it from epilepsy. There's no reason it wouldn't, in certain constellation, work for ASD.
Before we move on to access, I just want to ask, is there any other impact you saw with Yuval besides his agitated behaviors and besides his epilepsy? Was there anything else unexpected or you didn't think medical cannabis would affect him?
I think what happened, he's more communicative, he's more listening, he's more available because he's more in peace inside. Yuval was always very restless. He's a lot of movements, a lot of, like, inner turmoil. And the cannabis, you can suddenly see him sit and watch TV, which we didn't see before, or he listens and he sometimes, not always, he collaborates better with us. But it became fun to be with it. I mean, when you know, because, okay, when you have a 23-year-old severely autistic son, you understand the autism is there, okay? It's a different stage in life, because I do see younger kids that make big progress with cannabis, by the way. But you say, okay, he's autistic. I love him the way he is. I just want him to be happy and to have some quality of life.
Yeah.
And for us, his family, because when you have this turmoil in your house, you can't live with it. And this is what I see with so many other kids now, that it made a change for the families and the child to be able to stay together, to have some quality of life.
Right. So I just want to address here, and just talking to the audience for a minute. So this is an incredible changing point, it sounds like, in your life, where you've had access to something that completely affected his behavior and your family life. And the challenge that many of you know who are listening, who have read up on cannabis, is there's issues with, first of all, understanding what strains, what doses, what kind, right? So that's one piece. And then there's a whole piece of accessibility and legal issues and threats of taking kids away. So it's a very delicate issue, and it's a very complex issue. So I want to sort of switch gears here from how this has impacted your family and the incredible impact it's made with Yuval and the rest of you, to the incredible work that you're doing now, because Abigail is an incredible trailblazer and is really working endlessly to make this an accessible treatment for families who are dealing with some of these very same challenges, outbursts, agitated behaviors. Who knows how else it can also impact, like you were saying, more communication, more listening, more cooperation.
And it has some healing. I mean, I do know anecdotal stories of kids that made a huge leaps, huge progress with cannabis treatment, but it's still anecdotal. Once I saw what it did to Yuval, I said to myself, impossible. No way they would, here in Israel, this is what I knew then, doctors would offer antipsychotic medication to kids as young as 3 or 4 years old. There's no research saying there are long-time side effects, and won't have the access for cannabis. I mean, my agenda is not, I'm not against anything. I'm for anything that works with my kid and other kids, but I think when you come to a doctor, I want the cannabis to be an option. It's a choice of a parent if he takes it or not. But the fact that he can't get access to it annoys me.
To say the least. Okay. Say the least. Okay.
And the way to do it is not just me screaming mother saying it helps, it's having a clinical study, it's having data gathering, it's better understanding what really works there for our kids. So this is what I'm doing now, because I understood that saying cannabis work, some people will listen, some wouldn't. But if you come to a state, in the States, every state has different medical plan. Autism considered qualifying condition, I think at 3 or 4 of them out of the 50. And I think if we had a proper paper saying cannabis, medical, scientific paper, saying cannabis works or cannabis help this and this with autism, it will be easier for parents to convince the authorities, the medical institutions, the clerks, or whoever needs this piece of paper, I'm sorry, to cover their asses and help us get access to cannabis. And this is what I'm doing, basically.
So what she's doing, in other words, is a part of a groundbreaking, first ever
data
gathering on the impact of cannabis and children with autism, and the specific behaviors of the outbursts, the aggressive behaviors. The research on epilepsy is being done separately to that, so that the information can be gathered, so that parents can be informed, so that doctors can be informed, and then hopefully that will lead to clinical studies.
We try to do a few things. First of all, I'm working with Sharon in Berman. So Sharon is mainly guiding the parents who do have access to find the right strain and the right dosage according to the case, because it's a complicated plant. We know it's not only THC, CBD, and I can't say we found out a strain that works for everyone.
Right.
I don't believe we will, by the way. But what we can do is take these few, we have about 70 today adults and children in Israel, and we have more and more all the time, and check or do this questionnaire and data gathering about their behavior before and after in a cross with the strains they received. And for that case, I told you I'm trying to collaborate with the Technion lab, which has a big database project. So the strains are checked there while we're doing the behavioral data gathering.
Right, so then not only while they're gathering information about the impact of medical cannabis on people with autism, but then you're also beginning to sift through and gather information about the specific strains and the components of the plant itself.
Yeah, so even though the questionnaire are not validated one, like it's not going to be scientific enough to be accepted in a premier journal, it will be enough for us to start understanding, even in a clinical study, what we want to give the kids to show it works. Because and
to help people that already have access understand what's going to be the most effective strain for them. So it's both helping people who currently have access and helping to push forward so that people who don't currently have access will more likely have access in the future.
Yeah.
So all of you listening, she's your lady. Abigail Dar is really putting forth a tremendous amount of effort, but because of the experience you had personally in your life with your son Yuval, which you're continuing to see, and what I'm so grateful for, and I'm sure everyone who's listening is grateful for, and other people I've interviewed in the cannabis industry are grateful for, is that you're taking that personal experience and you're using it as a pillar to lead forward so that this can become an accessible option for families all over the world.
It's not only it's by today, because I'm into this process for quite a while now. I think there's about 70 kids, which very high percentage of them, the quality of life changed. And we're talking about kids and adults.
70 kids in Israel, you're saying?
In Israel. Kids and adults that have been all through all kinds of medications, all kinds of therapies. And this is what gave them some quality of life, some peace. Some of them living at home, some of them live in housing places, and each one of them, it's it makes me happy.
Yeah, that's a huge impact. It's a huge impact, and as you said, it's impact on the child, the person with autism, and the entire family,
the entire environment,
especially if you're in a space of fear.
For me, every time, because Yuval is 23, and I just told you we had outbursts 2 weeks ago because I was changing some strains. We said it's
right.
And maybe it's important even to say that it's a trial and error, and it's not 100%. It's not a magic. You have to work. But we did have a big outburst, and every time it happens, and it was really hard one, because after 18 months of not having outbursts, you think you got over it. It's not going to come back, and it did. But every time the first thought I have in mind is, who will be able to handle this man I love once I'm not able, because this aggressive outburst, self-injurious behaviors make it almost impossible for the other people to care for him.
Right.
And this is why I find cannabis so important.
Well, thank you so much for your time. Thank you so much for your work. And just so everyone who's listening knows, the intention of this video is, number one, educate you as parents and professionals about cannabis, about the possibilities around cannabis. Two, and this is a big part of the work, to really reverse the stigma around cannabis, right? There's so much stigma around it, what it means, the recreational uses of it. What we're talking about is cannabis as a medicine to really heal children and to heal families. So one intention is to really educate everyone who's listening on where cannabis stands today and the impact it can make on your child, and to also be knowledgeable about what's happening in the process, and that you have warriors like Abigail Dar that are pushing things forward that we are incredibly grateful for. And you as a parent or as a professional, need to check in with your own health professionals, ask questions, really do your best to get involved, know what's legal and access in your specific area, and pray that these projects continue to move forward, are continuing to move forward to make this so that we can understand more, so that we can give more access, so the treatment can be more targeted for children and for adults. What I'm also going to do is put a link on this video a little bit afterwards to Abigail's page. So anyone who wants to know more, wants to get involved in this kind of project, can contact her that way, so we can gather even more information and get as much support as possible. So you're going to be seeing us again at the Cannabis Conference at the end of this month. There's an international cannabis conference here in Tel Aviv. I'll be moderating a panel of mothers, including Abigail, so you'll hear more of her story and other parents who have their own stories and the use of medical cannabis and how it's affected their lives. So thank you for joining us, and I'll keep the link on the video so you can learn more about it that way. Take care and have a great rest of your day.